Good morning. My name is Ankoor Shah. I'm a board-certified pediatrician, and I'm representing the District of Columbia chapter of the American Academy of Pediatrics. So the American Academy of Pediatrics is a national organization of over 60,000 pediatricians. Our DC chapter has over 400 pediatricians and training pediatricians in hospitals, clinics, school-based clinics. Currently, as you know, if a student is absent for at least 20% of the day, it is considered an absence. After 10 unexcused absences, there is a trigger to social services and then a trigger to court for teens after 15 unexcused absences. According to the Children's Law Center, half of the city's high school students in 2013 and 14 are considered chronically truant. So all of this has caused an inefficient system of engagement from social services and city agencies. So it's obvious there's a problem. I believe the council is trying to solve this problem with the School Attendance Clarification Amendment Act of 2015. And there are three aspects of the bill I want to talk about today. First, we fully support and applaud the provision that prohibits expulsion or suspension based solely on absences or expulsions. It doesn't make sense to punish a child for not coming to school by taking away more education from them. Research bears this out as well. Students who are involved in the juvenile justice system are likely to have been suspended or expelled in the past. Children who are suspended or expelled are 10 times more likely to drop out of high school. And also, if a student's parent works, then it's more likely that the unsupervised student will go down a path of riskier behavior. Second, we completely agree that any child suspected of truancy should be returned to school as opposed to a truancy center. Many of my patients have already have such a negative relationship with the criminal justice system from what they witness in their community to their own personal experiences. The school to prison pipeline is real, and the more we can separate education from criminal justice, the better shot we're giving our kids. The last issue is the crux of the bill, which counting absences as those who miss a full school day and not just 20% of the day. And while I understand that identifying children who are this will help identify children who are truly chronically absent, ease the administrative burden, as well as not penalize people or students for being tardy. And I'm a pediatrician, so I often approach problems as I do with medicine. So say I have a child who has an infection that's causing a fever. If I treat the child with Tylenol, sure, I'm going to fix the fever temporarily, but I'm not doing anything to solve the underlying problem until I start prescribing antibiotics. Likewise, I just worry that by changing the definition of absence, are we addressing the symptom of approving absences while not dealing with the underlying issue of children not being present for school? What are we doing about the child who misses 50% of the school day chronically now? Will the schools be able to identify and respond quickly enough to fit that child's needs? I frequently see children in my own clinic with poorly controlled asthma who are in and out of the hospital and or homesick because of mold in the house, smoke exposure, poor access to medications. These children are getting excused absences, but are still missing school nevertheless. I reference this because the goal is for all students to be in school, and any pattern of misattendance should be investigated and addressed. Chairman Mendelson mentioned that most people think truancy is an educational issue, which it is, but it's also an indicator of children at risk for entering the juvenile justice system. I would argue a little bit more. I would say that truancy is interconnected with health, transportation, housing, as well as multiple other factors. So we believe this bill is an important step, but we urge the council to start attacking upstream causes of student tardiness and absenteeism with its partners. Thank you.
Thank you very much.